Hello friends, in anatomy and physiology class, this is Hassan Nafid at Madison College in Wisconsin. We're going to continue talking about the respiratory system anatomy. This time we're going to talk about the upper respiratory tract. The upper respiratory tract starts from the nasal cavity or the nostrils or the nasal opening and ends at the larynx. The upper respiratory tract also includes the mucous membrane that lines up the airways or the air passages. I have this model here to share with you. To start with, I'm going to show you the nostrils or opening the nose. If I turn it sideways to show you the nostrils, this is the nasal cavity. The nasal cavity is lined up with mucous membrane. It also does contain the olfactory receptors, and these are the receptors for a smell. Substance need to be dissolved in the mucosa of the nostrils of the nasal cavity to be interpreted as aromatic or smell sensation. In the nasal cavity, we have the nasal septum that divides the nasal cavity into two parts, right and left. Here there is some other structures that you see. This is the superior nasal conchae, middle nasal conchae, and the inferior nasal conchae. Also, looking at the roof here of the mouth, you're going to see the hard palate, and in the back you're going to see the soft palate. The nasal cavity would lead to the larynx, and the larynx is divided into its three parts. This area is known as the nasopharynx. This is the oropharynx. So nasopharynx, oropharynx, and this is the laryngopharynx. Taking a look at the larynx is a structure that is formed of 9 cartilaginous structures. These are working together to direct the flow of air to the trachea or to the windpipe. Behind it, I want you to observe and note this is the esophagus, and this esophagus is a passage of or passage for food, while in the front or anteriorly here, if you lift it up a little bit for you, you're going to see the larynx. So this is the larynx area. This is the esophagus. Taking another look at it, again, this is the esophagus. Well, this is the larynx, and the larynx, this is the vocal folds, right? And this is the epiglottis. The epiglottis is a little flap of cartilaginous, soft cartilaginous tissue. It's elastic tissue. This is the only elastic cartilage that is among the 9 cartilage that forms the larynx. The rest of them are hyaline cartilage. The epiglottis is the only one that is elastic cartilage. The epiglottis will work to close the windpipe or the trachea upon swallowing. This is another good model that's showing you more details of the upper respiratory tract. Again, nasal opening, nasal cavities, the conchae, superior, middle, and inferior, nasopharynx, oropharynx, and laryngopharynx. I wanted to show you this because I want to show the larynx. This is the larynx right here, the one we talked about. When the larynx, upon swallowing, that means the food is coming down the esophagus, it flaps back like that, and it closes the opening of the trachea. So it goes back upon swallowing, so it protects the windpipe and protect the food from going the wrong way or the wrong direction to the trachea. Also, upper airways are equipped with sinuses, and these are air-filled cavities. This is the frontal sinus, and this is the sphenoid sinus. This is sinuses makes the skull weight lighter. They also helps to adjust the temperature of the air. They also helps in the resonance of the voice. This is a larger model that shows you the details of the larynx. As we said, the larynx is the cartilaginous structure that is found in the upper airway. Actually determines the partition and the border between the upper airway and the lower airways. Taking a look at this model here, we're going to identify some structures. This is the hyoid bone. Turn it around. Underneath, this is the thyroid cartilage. It's a large cartilage. This tip of it, which is the prominent part, and the neck of an adult is known as Adam's apple. Thyroid cartilage. Underneath it, we will find the cricoid cartilage. And this is the cricothyroid ligament that connects the two together. If we lift it up a little bit, this is the trachea, and these are the tracheal rings. The tracheal rings are a C-shaped or incomplete circle of cartilaginous tissue that supports the lung, prevents its collapse, and make it more patent. On the side, and each side, we're going to find the thyroid gland. This is the left thyroid gland, and of course the right thyroid gland is removed from here for the purpose of clarification and explaining the anatomy. You see the thyroid artery running on the surface of the thyroid gland. There is two thyroid glands, one of each side. The thyroid glands will move upon swallowing. So when we swallow, you can feel the thyroid glands moving up and down. Looking at the posterior part of the larynx, again, this is the epiglottis. The epiglottis lying on top of the glottis, which is here. This is the glottis. This is the epiglottis. The epiglottis, as we said, it descends and bends to prevent or protect the opening of the trachea. This is the arytenoid cartilage, and these are the corniculate cartilage. These are the cartilage that we said are hyaline membrane, except for the epiglottis, which is elastic cartilage or elastic type of cartilage. It's a soft tissue and it's supposed to be soft so it can move freely up and down and protects the airways.